this is Dr. Eisenbrown. I'm here to answer some of your questions about the common urology problems that we see. Let's talk about recurrent urinary tract infections first. First of all, it is very, very common for women to have recurrent urinary tract infections. It first occurs when we first become sexually active, so in our teens and our 20s. In fact, we call it honeymoon cystitis. The reason for that is that every time we have intercourse, we do get bacteria pressed up into our bladders, and our bladders are not used to it. For the most part, most women will outgrow that, for lack of a better term. However, it also becomes more common when we get older, and the main reason for that is loss of estrogen. So anytime after the age of 35, and certainly after menopause, we become much more vulnerable to recurrent urinary tract infections. The reason for that is that estrogen is very important in protecting the bladder from infections for several reasons. Number one, there are estrogen receptors along the urethra and the bladder neck that help keep that mucosa spongy and tight, which minimizes the access of bacteria to the bladder. It also is responsible for keeping the vagina healthy, which is where the bacteria that gets into our bladder comes from. It's not a hygiene issue. It's not like all of a sudden you forgot how to wipe. It's that the environment changed and you became more vulnerable to having infections. What happens is when you lose estrogen, the vaginal mucosa thins. As it thins, the secretions not only diminish, but the pH goes up. The pH is what controls the balance of the good and the bad bacteria. So as we get older, the lactobacillus, which is the good healthy bacteria, die off, and in move E. coli and Klebsiella and his friends. And that's when we become more vulnerable to infections. I think of it as a little bit of a numbers game. The more of the bad guys outside of the fort, the more likely they are to get in and cause havoc.